So today I actually want to talk to you guys about something that was brought up last week. Hi, Dora. Hi, Lords. Last week, Alua asked, how many do you have to get right on the written exam? Now, I wasn't able to get to this question because this is a really big question. It's not as simple as, well, you can miss 5 things and still be okay. The grading is not that easy. So I needed some time to really kind of help you understand how the written test is graded on the state exam, and I need a little time to do that. So I pushed that question off till this week. So what you have to understand is when it comes to the written test, now the written test is, it's a written test, but it's given on a computer, so it's multiple choice, so you're selecting one answer on the screen. It's not a written test as in you have to have a pen and actually write out, essay answers or anything. This is a multiple choice test, but it's going to cover more theory than skills. So skills will be on it, but the skills are actually graded during a skills exam where you have to physically perform those particular tasks. The written test is designed to cover more scenario-based questions. What are you going to do when? Now, you're going to have 60 questions on the state exam, but only 50 of those actually count towards your grade. Not all of the questions that you see on the exam are actually going to count. The problem is they don't tell you which ones count and which ones don't. All you get to see is 60 questions, and you have no idea which ones are counting and not. But I want to talk to you real quick about those 10 non-counted questions. What are they? Why are they even there? These are called pilot questions, and these are 10 questions that they're going to use on a future exam that will count. But when it comes to writing questions, there's an art and a science to it. It's not as easy as throwing a bunch of words together and here you go, here's a question. There's an art to it, but there's also a science to it. And they also have to make sure that it is a properly worded question, that it's not misleading. So like if I write a question, it's going to make sense to me because I'm the one writing it. I know what's in the brain. I know what I'm trying to identify. So when I read that question after I write it, of course it's going to make sense to me. I'm the one that wrote it. I know what I meant by it. I'm not the best judge of whether that's a good question because I'm biased. So when these questions get written, they take 10 out of the whole big group and they put them on different exams. And you may have 10 different pilot questions than somebody else has. And they keep track of what answers are selected and what percentage of people got the questions right. Now, if everybody that takes this question gets it right, it's not a good question. It's too leading. It's giving you the answer. That's not really what we want here. But if a whole bunch of more people get it wrong than right, that's not a good question either, because that's misleading you in some way. It's getting you to come to a different conclusion than you should. So when a pilot question is on a test, they're looking to see, did a good amount of people, it's called the state average, did the state average of people pass this question? If over a period of time, when they collect this data, a certain percentage of people actually passed that question by choosing the right answer, then they know that this is a good question. And later on, it's going to be put on the state exam for a counted grade. Okay, so these 10 questions, they don't count for you, they don't count against you, but they're keeping track of what answers are selected, whether people pass or not, so that they can evaluate whether it's a good question or not. So those are 10 questions that don't count. So let's go back to the 50 that do. Okay, so get those out of the way. So let's talk about the 50 questions that do count. On the state exam, you will have a question and then 4 answers. Now, on most questions, you have to get the answer right to get credit. Okay, so if it's A, B, C, D, the right answer is A. If you choose A, you get points. life is good. But there are a few questions that are so important. I mean, they're what we call critical concept questions. They are so important that if you miss that question and you choose an answer that puts somebody's life in danger, then that alone can flag the exam. So let me give you an example of this. So in the critical concept questions, it's not enough to just choose the right answer. You actively have to avoid the wrong answer. I hope that makes sense. So fire safety follows this. Okay, so a lot of times you'll have a fire safety question on the exam. So one of the most common fire safety questions is about RACE, R-A-C-E, rescue, alarm, contain, extinguish. That's how we deal with a fire. And you need to know that. Like, you need to be able to mumble that in your sleep. You need to know that so completely. Because when a fire breaks out, you don't have time to go run and find a policy and procedure manual and, oh, what do I do first? What do I do next? You've got to know what to do. Because it's an emergency, we don't have time to research the answer. So you've got to act. Emergencies always require immediate action, not research. So rescue is the very first thing that we do with a fire. R for rescue. Rescue just means get the patient out of the area of the fire. Patients and fire do not mix. We never want a patient and a fire in the same place at the same time. Not a good idea. So the first thing that you want to do is get everybody out of that area, right? Now, a lot of people, the first thing they want to do is go call 911. But that left a patient in an area with a fire, which is a big no-no. Even if the fire is small, they're inhaling smoke. The fire could spread. It could come across something combustible or flammable, and now we've got a bigger problem on our hands. So the first thing you do before anything else is get the patient out of the area. This is like critical. So you may have a question on the state exam that says you notice a small fire in a trash can at the side of the patient's bedside. What is the first action you would take? A, remove the resident from the room. B, pull the fire alarm. C, extinguish the fire with a cup of water sitting on the patient's bedside table. Or D, call the nurse for help. You know, so of course we're going to remove the patient, but what if you didn't know that? What if you thought to yourself, you know, it's a small fire. The question says it's a small fire burning in a trash can. There's a cup of water right there. I can dump that water in the trash can, put the fire out, and I'm a hero. I've saved the patient. If you choose that answer, you are effectively putting the patient at risk by not following the process, the procedure that's already in place. So if you chose pull the fire alarm, it's not going to give you points, but it's probably not going to count against you either. But if you chose put the fire out with the water, that is going to count against you because you don't know what else is in that trash can. So when you pour the water in, it may activate something that's in there and cause the fire to spread. You did not get the patient out of danger. So what they're looking for here is they want you to choose an answer that follows established protocol and keeps the patient safe. By choosing an answer that doesn't follow protocol but doesn't really hurt the patient either, that's not going to count as against you. If you choose an answer that actively puts the patient at risk, it's not just going to not give you points that you need, it's going to take points away. It's going to assign a penalty because you put a patient in danger. So when it comes to these written test questions, and there's only maybe 2 or 3 on the test that are going to that are critical concept questions that have the ability to count against you. But when we're talking about the grades for the state exam, we have to take this into consideration because it's not just enough to choose the right answers. You actively have to avoid the wrong ones as well for these particular questions. Now, the problem is they're not going to tell you, okay, that's a critical concept question. You're never going to know that an answer that you chose counted against you. So, and I see this a lot. People tell me this a lot. Well, I missed the written by 1 point. There's no way to know that because the grading is not published. Okay, and I want to make this kind of clear. So if you go onto Prometric's website or Pearson's website or Red Cross's website, it doesn't tell you anywhere in there that you need a 70% or above to pass. All it says is that you have to have a passing score in each category, but they don't tell you how that score is determined. So there's no way of knowing whether you passed by 1 point or failed by 1 point because the grading is not published. So it's really kind of important that we understand that you have to pass the written test, but they're not going to give you a whole lot of information about the grading process itself. That's very internal and it's very secret. But I can tell you, you have to pass each category. So passing each category actually means that you not just choose the right answer, but you avoid the wrong answers, the ones that put patients' life at risk. So what are the testing categories? Well, this is a test plan, okay? This happens to be Florida's, and this is available in the Candidate Information Bulletin. If you have Pearson, it's available in there too. Red Cross publishes it. Headmaster publishes it. This is published material. But you can look here and see, this is all the content that's going to be on the written test. And it's divided up into categories. You have to have a passing grade in each category. Now remember, they don't tell you how they're going to calculate that passing grade, but each category has to have a passing grade. Now each category is going to have a certain amount of questions. So if you just kind of go by that 70% benchmark, which is probably pretty close to what they're grading you on. If you go by that 70%, there's one category in here that only has 7 questions. So if you've got to get a 70%, that means you've got to get most of those right. You know, missing 3 or 4 questions in that category is going to drag your score down significantly. So the written test grading process is a whole lot more complex than it seems on the surface. It's not like a test you take in school where, you can miss 14 questions and still pass. It's way, way more complex than that, the way it's graded. And that's why it's not, the grading standards aren't published. But the graded content is, and that's what you see on the test plan. Now, if you go onto my website, foryourcna.com, under training, I actually have a practice test up there. And when you take that test and you go to the very end of it, you got to answer every single question, and then you hit submit. It'll give you a score, and then you can hit review, and it will show you the questions and the right answer, and then it tells you which one of these standards that question addressed. So I actually wrote that test with this right in front of me so that you can see the type of question you would get for that particular standard. And that might be a fun exercise for you to kind of see the types of questions you would get for each one of those topics. But the written test is it's a really hard thing to describe how it's going to be graded. It's not as simple as long as you make a 70, you pass. And this is why. If you don't pass safety, okay, if you have 7 questions in this, or 9 questions in the safety category, and you miss 5 of those. Now you got everything else in the whole test right. You've only missed 5 questions on the entire test, but they were all safety questions. Are you going to be a good CNA? Are you going to effectively be able to care for those patients without causing injury or further degradation of care? Well, the test is telling us you're probably not. You're probably going to cause injury out there because you don't understand safety. So even though you only missed 5 questions on the entire exam, it may still fail you because it's showing that you are unsafe. You lack safety principles to keep the patient safe while you're providing care. And that's really what they're looking at. And again, we have to remember that this test is not about us. It'll never be about us. The test is always about the patients that we're going to be caring for. So when you have questions on the role of the nurse aide, they want to make sure that you understand what you're there to do, what's in your scope of practice, how to report observations, how to communicate effectively. These are topics that are critically important for you to be successful. When you're talking about promoting health and function in residents, helping them do daily tasks, encouraging independence, encouraging socialization, making it possible for them to live as full a life as possible, and understanding how bathing and dressing and grooming and eating and all of those different ADLs that we do impact their overall state of well-being, right? That's all promotion of function and health of residents. Understanding that is a foundation of CNA. If you go into this thinking, well, I'm there to tell them everything that they're going to do, and I'm going to be the boss of them, and they're going to do things on my schedule, and you just have this inflated sense of self-importance, you're not going to be caring for the patients properly. Therefore, you are not promoting their function and health. So they're looking at that. Providing care for residents with specialized changes, right? So things like Parkinson's, working with dementia patients, recognizing the signs of a urinary tract infection, that type of thing. That's going to be very, very important as you test, but also in a clinical setting. So you want to make sure that, we are testing you, candidates, to identify whether you have these basic skills so the patients are going to get good quality care. So the test is not about you. It's not about you passing or failing. It's not about your skills performance. It's all about how effectively you can care for the patient once you're certified. And when you start to realize that, when you start to kind of get your brain around that concept, the test actually becomes easier because you're no longer thinking about you. You're thinking about the patient, which is where your focus needs to be in healthcare anyway. And that helps you answer these questions much, much more effectively and give you the best opportunity to pass. So on a similar note, testing results for the clinical skills is also very, very difficult to describe. So a lot of people are well, how do they grade the clinical skills test? If the written is this hard to grade, how are they grading the clinical skills? And the clinical skills are very, very similar. Everything is going to be weighted differently depending on the impact it has on the patient. So you can't just say, oh, well, you can miss 3 things on each skill and still pass. It really depends on what those 3 things are that you're missing. If you leave the bed up far from the floor, that one step can fail you. And that's because when the patient goes to get out of bed, they expect the floor to be right where they left it. You moved it when you moved the bed. They're not expecting that. So when they go to get out of bed and the floor isn't there, they're going to fall because they put their feet down as if the floor is there. So when it comes to grading standards, it's a whole lot more complex. The best advice I can give you, this is what I tell my students all the time. Don't focus on the scores. Don't focus on how many can I miss, because you kind of miss the point. I want you to focus on learning this as well as you possibly can, because it doesn't matter what score you get on the test. What matters is when you get out there in a clinical setting, how prepared are you? How functional are you going to be with the real life patients out there? So don't study for the tests, study for the patients. And when you do that, the test really does take care of itself. I hope that helps you guys.